I'm Dr. Rachel Ruffin. I'm a staff psychologist here at the Durham VA and the director of our trauma recovery program. My grandfather was a POW in World War II, and after that, he chose to not get care at the VA. I mean, the VA was around back then, but I think a lot of his mentality at that time was to not look for a handout, and so try to stick it out on his own. He died by suicide when I was young. Whew. So, yeah, I mean, it's hard to talk about, and sometimes I also feel like we should be talking about it more. I think about the trauma he went through and how likely he experienced PTSD, but in some ways I actually think depression might have been the primary culprit. I think it's important for folks to know that trauma does not only lead to PTSD, it can lead to a whole constellation of mental health disorders and symptoms, including depression. Part of the reason I wanted to build my career in the VA was the VA has been a leader in many ways in evidence-based therapy. I think we set a really good model for team-based care, interdisciplinary teamwork, so having patients who were getting care kind of in a wraparound sense. So their mental health care was in the same system where their medical care was, where other services were brought to them. And as a VA psychologist, I get to work with people who I think might never get therapy otherwise, honestly. We just reach people, I think in particularly men, who would not see themselves as somebody who would seek therapy. There can be stigma, there can be other factors. Just having someone suggest to them that this would be helpful just isn't something that might happen for some of the folks that we work with here. And so being able to reach some of those populations was important.
My name is Carolina Clancy. I'm a psychologist in the trauma recovery program here at the Durham VA. I'm also the evidence-based psychotherapy coordinator for the facility. Evidence-based psychotherapy is basically a therapy that's recovery focused. And what I mean by that is that when people are diagnosed with a mental health condition, oftentimes they think that they can't get better, that there's no recovery possible. But we now know from years and years of research that people can feel better and can recover from a mental health condition. So evidence-based psychotherapy really is there to give people hope that they can feel better, that they can recover. Our goal is to teach people tools so that they can become their own therapists. We engage in a shared decision-making process. We talk about what resonates the most with the veteran, whether it's writing, whether it's talking, whether it's putting together an action plan. The variety is important because we want to make sure that people can select the treatment that makes the most sense to them. If there's someone out there who's not seeking mental health, what I would like to say to them is help is available, recovery is possible, and don't be afraid to reach out. Anyone at the VA, whether it's your primary care doctor, your case manager, anyone that you come in contact with can put you in touch with mental health. And one of the things that I can't emphasize enough is all of us in mental health are here for a reason. We enjoy helping others, we want to help others, we find it meaningful, and we want you to come and ask for help because we're here to help you.